Welcome to Conversations Different, a podcast from the Santa Fe New Mexican about the interesting people, places, and issues of northern New Mexico. This is Inez Russell Gomez, and today I am speaking to Dr. Miranda Durham, Chief Medical Officer, and Andrea Romero, Head of the Vaccination Program, both with the State Department of Health. Welcome, and thank you guys for coming.
Thanks for having us.
Yeah. Well, I guess you could say we are living in interesting times when it comes to vaccinations. And I wanted to have you guys on to talk about what New Mexico is doing differently than what is happening at the national level. So as Chief Medical Officer, Dr. Durham, talk about why we are keeping the traditional and current vaccination schedule.
Yeah, thanks for the question. I think, so we made the decision for our state. That's really our job in the Department of Health, to make the best decisions we can for New Mexico, and decided to stick with the American Academy of Pediatrics schedule, which until very recently aligned perfectly with the CDC schedule. And we did that just looking at, we're trying to decrease confusion, maintain access for as broad access as we can for people across the state. And then just looking at some of the diseases that we deal with, like right now we've got super high flu rates and it's in kids. And so that
Right.
sort of idea of not recommending flu vaccine across the board doesn't really make sense for New Mexico.
Yeah. No, that makes sense. And Ms. Romero, before we were on, we were talking about all the ways the health department supports efforts for people to get vaccinated. So you guys are doing a lot of work to get the word out so as many children as possible receive these life-saving vaccines.
Correct. And as Dr. Durham mentioned, access is key. So we have over 300 vaccines for children providers in the state of New Mexico that provide access to the recommended vaccines that are on the schedule we are following. But we also have our mobile vaccine unit that goes into the community where there may be limitations of access. New Mexico is a large rural state, so we want to make sure that we are getting everyone. So where there is a community event that is happening, we are out there at those little community events, giving access for routine respiratory vaccines. But then, we're also helping the schools. We know there's shortages of staffing out there. So if we can help with any of those areas, we're going out there to schools and putting a mobile clinic on to ensure that children are caught up on their vaccinations as well.
That's really helpful because I know if you live a long way from the doctor and you go to see your pediatrician and maybe the vaccine supply isn't there or something happened, you can't get your shot or you don't have a Walgreens on the corner, if you live in Tohajali or something, then what do you do to get your vaccination?
Mm-hmm. And we understand those barriers, whether it be, transportation costs, anything like that, or, just sometimes traveling a long ways is hard on you. So if we can meet you, that's even better. That's somewhere that we want to make sure that there's not a missed opportunity, but also that we're protecting everyone that wants that protection vaccine.
That's really helpful. So Dr. Durham, talk a bit about the decision to keep the vaccination schedule as is. We have a Secretary of Health at the national level, Robert Kennedy Jr., who has been they call it a vaccine skeptic. It seems like too nice of a term almost, but he doesn't like vaccinations. And the recommendation now is to cut back the number of shots kids get. Is that correct?
Yeah, I mean, they basically took the standard set of vaccines that have been recommended for all children, and that's about 16, 17 vaccines, and moved them into 3 different categories. So one category is still vaccines recommended for all children One category is vaccines recommended for high-risk children, and that definition of high risk changes depending on which vaccine it is. And then the third is vaccines recommended with shared clinical decision making. And I think one perspective we have in the state is that public health makes broad recommendations about what's best, what we think is best on a broad population level in terms of protecting the population from disease. And there's always been shared clinical decision making as parents go in and talk to their provider, whether that provider's a nurse practitioner or doctor, the pharmacist, the public health nurse, the school nurse. But all of those people are there to really talk one-on-one in that shared clinical decision making. So I would say
it's always been there.
It's always been there, yeah.
Right.
And so we don't really see a need to kind of divide the schedule up. And like I said, it's not really that the vaccines, all the vaccines are still there. So it seems like just making the messaging more confusing, both for providers and for parents. And I think the biggest, one of the things we really want to drive home is that there just is no change to access or coverage in New Mexico. So the New Mexico Medicaid program, all private insurance, all are continuing to cover all the vaccines that have been on the schedule all along. And we really don't expect, because of we have so much participation from providers across the state, we don't expect access to any individual vaccine to not be there.
That makes sense. And I would assume in a state where so many people do have underlying conditions, vaccinations are probably more important than maybe in a country where everyone's healthy and fit or whatever, because if you get sick here and you're elderly and frail, you have a much better chance of dying than you would if you're a young, healthy person. Is that a consideration?
Yeah, I think there are a lot of considerations that go into a vaccine recommendation, and that's what we've counted on the ACIP and the American Academy of Pediatrics and many experts to kind of look at all those factors. So the safety of a vaccine doesn't change depending on which country you're looking at, but the amount of disease burden, the ability to access healthcare, those things do change country to country. And then just the willingness, some of it is an economic question, and we're very lucky in the United States that we are able, we're a well-resourced country overall, so we are able to afford broad vaccine coverage for people.
That's great. Ms. Romero, have you noticed people asking more questions, as the program goes out, because they're getting mixed signals from, the federal level versus the state level? Or is in New Mexico, people are just ready to get their vaccines and go about their business?
I feel like New Mexicans are ready to go about their business. I think we have a wonderful community. We saw the great response that happened during the measles outbreak. And so we have a community that asks questions. And that's great, because they ask all the right questions. What should I be doing? What are the recommendations for my age group? And I'm glad you brought up like the age population, because we do have a large older population in our state. And I always put those two together, just saying, even in my own family, but we always have a lot of the grandparents and grandchildren that spend time together. And so a lot of those grandparents often at times are looking for those recommendations too, because who do we see getting vaccinated? They're going to go in to go make sure they're caught up in their vaccines, and they're also going to be making sure that those kiddos are also caught up in their vaccine. So I feel like a lot of the times they ask for information and they want to confirm, which is the accurate guidance that they should be following and ensuring that that is the resource they have to go forward.
That makes sense. That point about extended families and intergenerational families is so important, because I know during the COVID pandemic, one of the worries that schools kept, they kept saying our school's closed too long. Well, teachers didn't want to send a kid home sick from school who would then kill their grandparent, because we had other issues to deal with in New Mexico that probably is around any kind of contagious disease, I would assume. Has that been your experience, Dr. Durham?
Yeah, I think the connection about, when you vaccinate a person, you're protecting that person, of course, but you're also protecting a broader community. And it's very interesting. The pneumovax is a good example, but we had pneumovax for adults for years. Then we started routinely vaccinating children against pneumonia, and that had a huge impact on the adult rates of pneumonia, almost more than the impact of vaccinating adults. So yes, we share a lot in families. One of those things is germs, and then if we all get vaccinated, we share protection.
Oh, that's a great point. And on that note, we'll take a quick break and be back in a moment with more Conversations Different.
We make renewable doable. We're positive energy solar for a cleaner, brighter future for all. Positive energy's the right call. Feel good about your energy bill. Help save the planet too. Your trusted solar company, working hard for you. Generate positive energy. Positive energy solar.
We're back with Conversations Different, talking to Dr. Miranda Durham and Andrea Romero about the need for vaccinations and what New Mexico is doing. Ms. Romero, one of the things I was thinking about is if people have questions, in addition to asking you personally or, nurses and different people when they're getting treated, is there a number or a website or any place they can go to get questions answered?
Yes, we have had a standing nurse hotline since the COVID-19 pandemic, and that number is 1-833-882-6454, and you will get a live, direct person that could give you that guidance and recommendation, and also any vaccine access location in the area as well. So this is really something that is high priority of talking directly to someone, because I'll give you an example of during the measles outbreak, when folks were able to contact someone directly and ask questions. This is the perfect hotline to speak with somebody and know what that guidance is, and also to get direction if folks may have symptoms, what to do when they have those symptoms to avoid any virus spread, because that is all part of preventable measures. So they're really instrumental with helping with guidance, recommendation, and access locations just in general, but very helpful and always available. And so I always say it's always important if you can have access to a direct contact that has that clinical background.
That's really smart. And I know, as someone who had a kid who was sick a lot, if I'd had that number to call once in a while, it would have been nice just to get a little relief when you're so nervous and maybe your doctor's not available. Dr. Durham, one of the things I've been thinking about with all this, not necessarily confusion, but different messages about vaccinations, how do people ensure that they're getting the best information? Because we have this saying now, I'm going to do my own research. But what if your research is terrible and you go to a site run by a kook? What can you do to get the right information?
Yeah, I think it's a great question, because there's just a lot of information out there. So it's a lot of work, even if you have great resources. And I think what we always recommend is people go talk to their provider. Their provider knows who they are, knows their background, and really can help make the best choice for you as an individual. I think the other thing, as Andrea is saying, our helpline does have nurses. We know there are people who don't have easy access to a provider, or maybe you don't want to make a visit just to ask a couple vaccine questions, but you can call our nurse helpline and they will, if they can't answer the question you have, they will track one of us down to get the answer. But they're very good at vaccine questions. They've been doing this a long time.
That's good. One of the things that has seemed interesting to me is that nobody likes to see their kid get a shot because they get fussy and sometimes they get a slight fever. But we always seem to understand that there's this greater protection that my kid won't get measles and perhaps die. And we're losing the connection between what the vaccine prevents and the possible outcome, I think. And have you noticed people not realizing what the consequence of losing our immunity might be, Dr. Durham?
Yeah, I think, I mean, I'm a medical provider and a parent. I definitely have great stories about my children yelling so loud down the hospital that I worked at, when they got their vaccines. That was a little bit embarrassing as a provider, but we got through it. They get over it very quickly. And then for a lot of the childhood vaccines, it's a lifetime of protection. I think on the provider side, most of us have seen patients, there are kids who still die of pertussis, and we had a measles death in the state, and, kids do die of these diseases. And it is true that we see that less and less. I think some of us older physicians have seen more of it. Yeah, and it is hard. We're so really fortunate to have had these vaccines, and to have that community protection. And it is hard to imagine, if you've never seen it, what can happen if we don't have good protections.
Yeah, I think we're going to lose our certification as being measles free this year as a country, I believe.
Yeah, the decision point is coming up. So PAHO, the Pan American Health Organization, will be looking at that. But Canada did lose their status. And it is, this was just such a remarkable, like back in the 60s, the rates of measles was so high. Introduced the vaccine, the rates just plummeted so quickly, the rates of disease. In the 90s, that there were a few more outbreaks. That second vaccine dose was recommended. And then in 2000, we declared measles eliminated from the United States, which is just such an amazing achievement. But it also means, so few of us ever had seen measles. And I think people did start to get a little bit, like, is this really important as a vaccine? But I think this year, with over 2,000 cases in 2025, and we're starting off in 2026 across the U.S., still going strong on the measles.
Yeah, that's so crazy. I just don't understand, when you've defeated something, why you'd let it come back. And
right, or why you'd assume that it doesn't take work to maintain.
No, that's true. Ms. Romero, as you go out and send people out to get vaccinations, I know that we got behind during COVID because people didn't go to their doctors that much. Is New Mexico catching up so we have the necessary participation to provide, group immunity or herd immunity?
Oh, yeah. We worked hard on that. We're making sure that we're getting children caught up. If you look at our school survey, vaccine coverage rates, we're in the 90% areas of vaccine coverage, and it even improves more for the 7th graders. But what we really try to do is our back to basics approach of what vaccines prevent from. So it's kind of going back and doing a new education and training, basically, because knowing that not all generations have lived through an outbreak. Maybe, the most recent was the COVID-19 pandemic, but they did not know of measles before, polio, and knowing what happened in that history, knowing how many deaths occurred, the impact it made at that time. It's, this is where trusted voices come in for storytelling and sharing their stories. It's really a high priority for us to continue that training and education in that way as part of our messaging, because even at times when folks share stories with me and they say, like, their grandparents lived through the polio outbreak and so forth, I'm just like, wow, because they really, compliment how much vaccines mean to them because they went through that.
No, that's true. And it's kind of a shame that we have to have that personal experience. New Mexico was really hard hit by Spanish flu back in the day. And I remember the stories that my parents told me about what it was like in their communities and how they couldn't even get someone to bury the dead because no one wanted to be near the infection. And they finally, worked it out and figured it out. But we got over that. And then we got to COVID and all of the things that were supposed to help us. One part of the state took to, and the other part of the state said, no, we're not going to do that. So we weren't even protecting each other at that point. What did that feel like for you, Dr. Durham, as a doctor, when you know these are things that work, but people don't believe it?
Yeah, I think it's, as a doctor, I think just something that we're used to dealing with, which is, not everyone always takes the recommendation that you give.
Right, we still eat hamburgers.
And I don't exercise as much as I should. So, we're all human, I think.
Yes.
And overall, as a state, I think, I think we do have to give the nod to the fact that COVID was confusing, long, tiring, and I do believe people sort of did the best they could with the information they have. Initially, at least,
yes.
We also had fantastic vaccination uptake, and then people did get tired of it. But
it was interesting to me how quickly it kind of became political.
Yes.
I went to a funeral in West Texas, and the only people wearing masks, this was like toward the tail end. It wasn't the worst part of it, but it was me and the family of the dead person. And everybody that lived in that town, no one was masked, but we all came from somewhere else. And it was just such an interesting worldview, in a snapshot.
Yeah. I think, one of as we're talking about this and vaccine acceptance, because I do think that people, COVID vaccine has a status of its own in terms of those kind of, political triggers. But overall, vaccines are still childhood vaccines are very well accepted. As Andrea is saying, we have over 90% kindergarten vaccine rate, which is amazing when you think about our state and all the challenges we have with healthcare. And really across the country, the vaccine rates for children is around 92%. So again, the narrative of no one trusts vaccines really isn't true. I think we have some challenges and some voices that are louder on that front than we've dealt with in the past. But overall, I guess I take hope from the vast majority of people who do recognize the value of vaccines.
Nice. On that note, we'll take a quick break and be back in a moment with more Conversations Different.
This is Patrick Dorsey, publisher of the Santa Fe New Mexican. Looking to reach a wider audience and grow your business? For 175 years, the Santa Fe New Mexican has been the trusted voice of Santa Fe, with unmatched local reach in print and online. In addition to our long-standing, independent, family-owned newspaper, we have a full-fledged marketing team with the expertise to help you succeed in the 21st century. From traditional print to precision-targeted digital advertising, we have the tools to connect you with your ideal customers. Partner with us and see the results for yourself. Advertise with the Santa Fe New Mexican and unlock your business's full potential. Visit us at santafenewmexican.com/advertising or call us at 505-995-3852. Thank you.
We're back with Conversations Different, talking to Dr. Durham and to Andrea Romero about vaccinations and where parents can get their questions answered, and non-parents, everybody, in fact. And one of the things we were mentioning during the break is that there is an even better number for people to call about questions. So Andrea, why don't you give us that number, and then we'll put both of them in our show notes.
Sure. So for our nurse hotline, it is 833-796-8773.
Okay, so people can call, and there are even Saturday hours, I understand. So if you have questions at 1:00 on a Saturday, that someone will answer that.
Saturday and Sunday, 10 to 4, they answer the phone.
Oh, wow, that's good.
Yeah.
Yeah, because kids always get really sick on Sunday. That's when everything's shut down. That's it. I tell you. I want to go back to what you said before we closed, the last segment, Dr. Durham, just that the idea that there is a confidence in vaccinations, that people understand really the beauty of public health and how many lives it has saved. And we need to remember that, don't we?
Yeah, I do think it's certainly important for us to remember as we work every day maintaining access across the state and talking to people about vaccines. But I think it's also just important as a narrative if it just isn't true that there's no confidence in vaccines, and I think that's important to keep in mind.
People want to get their children vaccinated.
Oh, definitely. We have reoccurring invites that happen in the community. So when there is local events that are happening, we know that, throughout the seasons, there's always something going on across the state. And so having that trust between our mobile vaccine unit and that community, I've been out there with them, and I tell you, those members of the community are like, "Oh, it's so nice to see you. Thank you for coming back out." And I'm like, "Hey, you guys are celebrities out here. They know you. They really like having them out there and knowing that they have that access there." So sometimes they make it as part of them going to that event that they take their whole family there, because sometimes that's the only time that they have around their work schedule, maybe, that they get to be out there. So knowing that, they're available after hours from that schedule, that parents maybe have those barriers that can't go to an appointment, but that at that same time they get to a community event, they could bring their whole family there.
Yeah, that makes so much sense. I know our family used to go to Christus every fall to get our flu shot. It was like we get our shot and go have breakfast, it's a treat.
Yeah.
Yeah. Yeah, this year it got rained out, and I barely got my flu shot like a couple of weeks ago, because without that stable appointment, it just didn't happen.
Yeah, it is really easy to procrastinate on those seasonal vaccines. There's not always someone there poking you, reminding you to, well, that's probably a bad word to use, but reminding you that you need to get the vaccine. And I think it is a good time to just remind people that it really isn't too late to get the winter respiratory vaccine. So flu is number one. That's what we're seeing across the state right now. It's just, flu has rolled into town, and we expect to be dealing with it for a couple of months. It's not a perfect vaccine in any way, but it does prevent hospitalizations and deaths. So we sort of like to say wild to mild. It'll take a bad case of flu and make it a little less bad. And sometimes it really does prevent the flu. Then there's also RSV for people 75 and over, which is a relatively new vaccine, but also recommended at this time. And that's just a one and done. So once you've had it, you don't have to get it again. And then COVID, which again, we're just starting to see COVID numbers creep up. Late summer was sort of the last time we saw a lot of COVID.
Yeah, the RSV vaccination is kind of interesting, because that's one that they're not recommending for children right now, if I understood it right. And yet babies who get RSV, as I know, taking my kid to the hospital 3 times before 3, are pretty sick.
Yeah.
Yeah.
So yes, there's RSV for the 75 and older
Yep.
crowd, but this really almost kind of miraculous was the RSV for infants, because like
Yeah.
you said, it is really a rough disease for infants. It's the number one cause of hospitalizations for children under 1. And so there's sort of 2 ways to protect them. One is mom in late pregnancy getting the vaccine, and that provides 6 months of protection. So for women who are pregnant in, heading and going to deliver in RSV season, which is now,
Right.
getting that vaccine is really incredibly protective for kids. Then there's this vaccine for the infant. So if mom doesn't get vaccinated, getting the monoclonal antibody injection. And again, I mean, it everyone just kind of watched while children's hospitalizations dropped last year. So it really and actually, if you read the fine print on the federal schedule, they're really just saying everyone's high risk if mom didn't get vaccinated. So in a way, like, they didn't really change the recommendation. They just made it more confusing for everyone. Yeah.
It just seems that this is something that needs not to be confusing,
It
if
needs not to be
possible.
confusing.
Yeah,
Exactly.
yeah. And Mr. Romero, do you have any, final words of encouragement for all the people? Let's say I'm worried about vaccinations. Maybe someone in my family had a bad experience or whatever. What do you tell people when they come to you and they're just nervous about it?
And many a times I use myself as an example. I've gotten vaccinated from a child till now, and it has helped me to protect myself, my family, my neighbors. And so stating that, that protection is not on protecting you, it's protecting your family and your surroundings. And that's huge, because I know that in our community, in our state, we care for each other a great deal. And so we care about our families. I always go back to that same perspective of caring for your elder. And that's a lot of traditional families do the same here in New Mexico. So continuing to do that, because that is what we've been doing these past couple of years. And it's been proven that vaccines work, they protect you. And it just shows that gratitude that we have, especially that we had during this measles outbreak that occurred, how much of that response happened from the community that protected us to declare it to be over. And so that alone was huge. And so using those examples and really spreading that gratitude back to the community, it just shows how much they care.
That's a beautiful sentiment. It's true. I mean, we take care of each other in New Mexico. And Dr. Durham, I know as chief medical officer, one of the things you don't want to see is a huge outbreak. I mean, I remember when hantavirus happened and the whole Department of Health was just tracking it down and working, with federal epidemiologists, et cetera. It's like, it's nicer if you're preventing instead of having to deal with the aftermath.
Exactly. And yeah, I think that was well said. That's really our job at the Department of Health, is working on the prevention side. And that said, we love when people ask us questions, again, especially in this environment, but also new vaccines like the RSV is, in the last 3 years, we have two sets of the population recommended for RSV. And it is a lot to keep up with, even in the best of circumstances. So we are really happy to talk through vaccines or any other health topics with people.
Well, we are lucky to have the Department of Health, and I thank you both for your time. And this has been another Conversations Different. We'll be back next week. Thank you for listening to Conversations Different, hosted by me, Inez Russell Gomez, editorial page editor for the Santa Fe New Mexican. Our weekly episodes would not be possible without your support. We hope you enjoy them and keep listening. New episodes drop every Tuesday. Consider signing up for our newsletter so you never miss an episode, and while you're at it, consider subscribing to the Santa Fe New Mexican. Our podcast is available by visiting our website, santafenewmexican.com/podcasts, or wherever you get your podcasts. Conversations Different with Inez Russell Gomez is produced by Matt Dalside and Ernesto Cisneros, published by the Santa Fe New Mexican, a local and independent newspaper owned by Robin Martin.